Michigan was already struggling with the fourth surge of the coronavirus before word came that yet another variant has mutated its way into circulation, the Omicron variant, said to be the version of the virus with the most mutations we've yet seen. Well, what does that mean for us? Should it inspire restrictions, or does the guidance remain the same, which is to just get the vaccine and the boosters? Let's talk about it with the state's Health and Human Services Director, Elizabeth Hertel. Ms. Hertel, good to have you back on the program again. I want to start with, give me your thumbnail right now, your assessment of the COVID picture in Michigan, which seems to be really as bad as it's been in the nearly 2 years of the pandemic when it comes to cases.
It's incredibly concerning right now. We're seeing cases continue to increase, hospitalizations continuing to increase, on top of other respiratory viruses that we generally see in the winter, like the flu. We expect that we will see more cases of the Omicron variant identified across the country and in this state in the coming weeks. And so I'm incredibly concerned about the pressures that this is putting on our healthcare system right now.
I hate to just keep stating the obvious, but the fact is the overwhelming majority of those who are hospitalized, and certainly of those who are dying from this disease, remain to be the ones who have not been vaccinated, correct?
That's absolutely right. It's very clear that the vaccinations are working, and the majority of people that we're seeing in the hospital, the majority of people who are in critical care, are unvaccinated or not fully vaccinated.
Let's talk, though, a little bit about what we know so far about the Omicron variant. I think a lot of people felt like maybe the panic button was being pressed a little early. Yes, it was spreading around South Africa, but only 25% of the people in South Africa have been vaccinated so far. It's probably too early for us to make a lot of broad assumptions about what this variant means relevant to the vaccines. But what's your take so far on this new version of the virus?
Well, we need to watch it closely. One of the reasons that people became concerned about it is that genetically it looks pretty different than the Delta variant. And so we know that it looks different. We're just not sure how that will affect the actual severity of disease and transmissibility, although it does appear that it is more transmissible. But we'll continue to watch this very closely in this country and across the world to understand how this new variant works.
I remember reading very early on in the pandemic, now we're, as I mentioned, we're almost into 2 years into this, very early on, that the natural course of a virus is that it becomes more contagious but less deadly. Is that kind of what we're seeing?
We're not sure yet. We're not sure yet. We'll continue to watch this, and we'll get a better understanding as it affects more populations around the world.
I saw a study recently that did seem to show a little bit of promise. Back in April, it was something like 27% of Americans were saying they were never going to get the vaccine. At last check in, I believe, October, it was down to about 13%. Are you seeing inroads and progress made on those who are willing to consider getting the vaccine and maybe have changed their thinking?
Yes, absolutely. The longer the vaccine is available, the more people who are getting the vaccine, the more comfortable people are getting with how safe it is and how effective it actually is. So while it may not be happening as quickly as we'd like to see across the state, every time somebody starts that new series of vaccinations is incredibly promising.
Well, the governor, as you know, has been criticized by some for being much more aggressive early in the pandemic with mandates and requirements, whether it was social distancing, masks, venues that were closed, and that is not the stance that's being taken now. Some are reading politics into it. What do you think is behind the governor's different approach now in the pandemic?
Well, both the governor and I know that we have new tools every time we are addressing a new surge here. And right now we have available to us the absolute best tool to help to end this pandemic, and that is these vaccinations. So we want to focus our time on making sure that people are getting educated, that they feel comfortable getting the vaccines, and that we're getting to those most vulnerable populations of people that we have concerns are at highest risk. COVID is here, and it is going to be here in the long run. So we all need to learn how to adapt to that make sure that we are practicing those good public health measures, the constant hand washing, hand sanitizing. And when we see surges like this, making sure that we're cautious about who we're spending time with, that we remain masked in indoor spaces. And not only will that help to prevent COVID, it also helps to prevent these other viral respiratory illnesses as well.
Well, you're absolutely right that we have many more tools at our disposal, but the numbers are what they are. If our numbers have reached a pandemic high, is it not time to step in and put further? The courts have obviously ruled that the governor doesn't have all the latitude that she used to have, but you do. Mm-hmm. The health department does.
Mm-hmm. Well, yeah. I'm not saying that we'll never see any actions taken again, but right now our focus is on making sure that we're getting people vaccinated and make sure that we're providing the supports and resources to our healthcare providers that they need.
It's probably too soon, I suppose, to read what kind of impact the Thanksgiving holiday had with people getting together, but we know that's going to happen again during the holidays. What's your concern level around that?
I'm always concerned about people gathering indoors. And I think that people will take those steps they need to make sure that they and their loved ones remain healthy. Gathering with people who are vaccinated, if people are unvaccinated, wearing masks when appropriate. Even some of that, opening a window, improving your airflow, doing those sorts of simple things can be very, very effective.
Lastly, Elizabeth Hertel, we have seen a lot of outbreaks happening in the state's schools, and we've left a lot of those sort of control measures to local control, which is part of the tradition when it comes to schools. But do we need a different approach? Are you concerned about how many outbreaks we're seeing among young people in our state schools?
I'm always concerned when I am seeing outbreaks among any population in the state. It's been very clear over the last few months that those schools that had masking policies were experiencing fewer outbreaks and fewer cases of COVID. However, we are making sure that our schools have access to the tools that they need as well, with increasing number of tests and making sure that their students are safe and healthy.
State's Health and Human Services Director Elizabeth Hertel, we so appreciate the time. I know you're swamped with requests these days as well, but thanks for talking to us, and we'll talk to you again soon.
Thank you so much.
You bet.